Hello everyone. Today's presentation is on telehealth in improving patient care and overcoming challenges. We are a group of 7 people: Jasmine, Tenzin, Saru, Leslie, Pushpreet, Jessica, and Amandeep. We're going to present the presentation today. So, the learning objectives. We're going to look at the benefits of telehealth in improving the patient care and also that challenges that are going to come up in that. Next is the ethical responsibilities in telehealth, and also we're gonna look at the innovative advancements in the telehealth and the potential impacts.
Hi, I'm going to discuss about the introduction of telehealth and its components. Telehealth is the use of digital technology such as mobile phone or to receive healthcare services instead of visiting a doctor in person. It is widely accepted and used, especially post-pandemic. Now I'm going to discuss about the key components of telehealth. So first key component is the telemedicine, which is the use of technology such like video calls or phone consultation for diagnosing and treating patients remotely. It involves virtual doctor visit. The second key component is the telemonitoring, which is the use of electronic devices to remotely track patient health data like blood pressure, heart rate, and blood glucose level and send it to the healthcare provider for monitoring. The third one is the remote patient monitoring. It's a type of telemonitoring uh, which track the patient health condition from a distance, often for a chronic disease management using devices like wearables. The fourth one is the M Health. M stands for mobile health. It's the use of mobile devices like smartphone apps, wearables to support healthcare practices. This includes everything from fitness tracking to medical apps for managing health conditions. Lastly, we have e-prescribing. It's the electronic sending of prescription from a healthcare provider directly to a pharmacy, reducing the need for paper prescription and improving accuracy. The importance of telehealth in modern healthcare and patient outcomes. It improves access. Telehealth allows patients to access healthcare services remotely, making it easier in rural areas without traveling. Secondly, is better monitoring. With tools such as telemonitoring, healthcare provider can continuously track patient health data like vitals. Thirdly, reduce healthcare costs. By offering virtual consultation, reducing the need for in-person visit, preventing readmission and traveling charges. The last one is enhanced communication. E-prescribing enables quick, efficient communication between the patient and healthcare provider in improving client condition and also helps in early diagnosis and treatment. Additionally, it allows patients to stay informed and engaged about their health condition. The overview of its growth during post-pandemic. Firstly, is the rapid adoption of telehealth, especially during the COVID-19 in the remote areas. There has been increased access with a specialist doctor in the rural area during the pandemic and post-pandemic. And there has been wider use of mobile phones and virtual visits. And there's a high demand of patient for the virtual consultation than the in-person consultation. And there has been better integration with the help of EHR, electronic health records. Lastly is a broader service offering, such as mental health and chronic care management. Thank you.
Now we know what telehealth is. So, next comes the benefits. So, improved accessibility. reaching out to the rural and the remote areas and also providing care to the mobility restricted patients. Next, chronic disease management. With the advancements in the technology, so the continuous monitoring through the wearable devices for the conditions like diabetes, hypertension, and COPD has come up. Next is cost effectiveness. It has reduced the number of readmissions in the hospital and savings for the patients and the healthcare systems.
Next is the reduced healthcare worker burnouts. It allows the healthcare providers to manage patient care remotely and reduce the physical workload, and also it provides the flexibility in scheduling and promoting the better work life balance. Next, enhance patient safety. It minimizes the exposure of infectious diseases by reducing in person visits and the risk of cross infections. It enables the real time monitoring and alerts for the critical changes in the patient conditions. For the last is improve patient engagement. It is easier as it allows the follow ups and education through the telehealth platforms.
Now, I will be discussing challenges of telehealth technology and current use. First, technological barriers and digital divide. Telehealth relies heavily on technology, which can be a barrier for patients who lack access to reliable internet or devices, or for those who are not comfortable using digital tools. As a nurse, this can lead to missed appointments, patient frustration, or incomplete care. An elderly patient may not know how to use video conferencing software, or a patient in a low income area may not have the proper technology to participate in a telehealth visit. This could prevent them from receiving timely care or follow ups. Another is informed consent and privacy concerns. Telehealth services require informed consent from patients, which must be obtained in a manner consistent with both state and federal regulations, including HIPAA, or the Health Insurance Portability and Accountability Act. A good example is a nurse must explain to the patient the potential risks of using telehealth platform, like data breaches and technical issues, and ensure the patient gives informed consent for the remote consultation. And if the nurse does not adequately inform the patient, they could be violating ethical standards. Another challenge is the regulatory and ethical issues. Nurses must be licensed in the state where the patient is located at the time of telehealth encounter. A nurse may face ethical dilemmas if they provide care to patient in states where they are not licensed, even if the care provided is appropriate. A nurse should only provide telehealth in the state where she is licensed to practice to prevent from having a legal and ethical issues, despite the consultation being conducted via secure video. Another is limited physical assessment. As a nurse, you're aware that many aspects of patient care requires hands-on assessment. Telehealth limits your ability to conduct physical exams, perform direct observations, and interact physically with patients, which can impact the quality of care you can provide, especially for complex cases. A nurse may be unable to fully assess the severity of a patient's skin condition, such as wound infection, through video alone. A physical examination might be necessary to determine the course of action, such as wound debridement or dressing change. Last is difficulty in building rapport. Building a strong nurse patient relationship can be more challenging in a virtual setting. Nonverbal cues and physical presence, which are essential for effective communication and emotional support, can be lost in telehealth interactions. This can lead to less trust and reduce patient satisfaction. An example is a nurse may struggle to provide emotional support to a patient experiencing anxiety or depression over a video call, as it's harder to gauge emotional cues and offer the same level of comfort as in an in person consultation.
Hi, my topic is ethical consideration in telehealth. So the first point in that is the informed consent. In that, we have to ensure that the patient fully understand the scope and the benefits and the limitation of the telehealth. We have to make sure that the patient is fully understand what we are saying and what the telehealth is. We have to use a simpler language rather than using the complex medical term, and also we have to provide the detailed information on how telehealth services work and ensure that the patient fully understand the information we are provided to, uh, especially during the virtual communication. We have to make sure about our language. So my next point is professional boundaries. In that, we have to maintain the professionalism by involving the ethical standards of in-person care. We have to maintain a special type of standard that we maintain in the in-person care while interacting with the patient, like language, proper dress code, especially attire, and the conduct during the digital consultation as well. So we have to make sure about that, and also we have to build the trust with the patient while keeping the professional boundaries in mind. During the virtual setting, we have to make sure that we are maintaining the interpersonal relationship with the patient so that we can boost our trust with the patient, so the patient can able to share their concerns and doubt with them. And also, next one is the accountability, and in that we have to establish the clear protocols to manage the emergencies, like technical failures or miscommunications during remote care. That is the main problem of telehealth. And next point is that to ensure that the all telehealth providers are trained to tackle the difficult situations like connection problems or the patient crises, and have a backup plans from the emergencies. So these are the main point for the ethical consideration in the telehealth.
So, for innovations, AI and machine learning in diagnostic and care, these AI algorithms analyze patient data to provide personalized care and predict health trends, and also assist with the diagnostics. And then we have wearables, which are the devices like smartwatches to track vital signs and enable real time monitoring, especially for chronic conditions. And also, we have teletherapy. This is more on the mental health platform. We have online therapy sessions, counseling, and support groups, which have grown and been expanding to access mental health care. Also, the telehealth services are expected to grow in rural regions, improving access to specialists and primary care providers for underserved populations. And also, EHR are increasingly integrated with the telehealth um, for seamless data sharing between in-person and virtual care. So, for future trends, we have AI driven virtual assistants and chatbots, which will help in triaging, symptom checking, patient education, and also administrative tasks in healthcare settings. We also have a virtual reality and augmented reality in training and therapy, which are used in medical education for training and simulation, as well as in patient rehabilitation and cognitive therapies. And for the last one, we have augmented telemedicine for remote diagnostics. So for this, using AR and VR or mixed reality, healthcare providers can guide patients through self-examination or provide real-time visual enhancement to remote consultation, which allow for more accurate diagnostics and treatment without the need for in-person visits.
How telehealth will help us as a future nurse leader. First point is improving the patient-centered care. Make use of the telehealth to prioritize patient needs and provide individualized care plans that suit their unique circumstances and preferences. Use telehealth to identify possible health problems, early allowing for prompt interventions and encouraging preventive care practices. To enhance communication and care coordination, make sure the nurse patient connections are consistent across telemedicine. And another point is advocacy for policy and reimbursement reform. In this point, our role, all the nurses' role is advocate for policies that address barriers like reimbursement issues and regularity hurdles to make telehealth accessible to all. And another point is guiding the adaptation to technology. An organization strategy and strong leadership are essential for the successful integration of telehealth into nursing practice. Give nurses thorough training to improve their proficiency with telehealth systems and digital literacy. Make sure there is enough staffing during training session to foster a positive learning environment. Thank you so much.